Is it a new COVID wave? Is hospital admissions soaring again? There has been a big rise in the number of people being hospitalized for the coronavirus in England again. Since mid-February, there have been more than 10,000 people in England who have been treated for the virus. As of Monday, 10,576 people were being cared for in the NHS's hospital beds, according to the latest figures from the Covid-19 Actuaries Response Group. Meanwhile, the incidence of new cases is increasing at a pace of around one a week. There hasn't been a single place unaffected. Every region outside the Northwest and London has seen an increase in hospital admissions of between 19% and 31%. A large number of these cases are not related to COVID, but rather to persons who were in the hospital when they contracted the virus and were not being treated for it. Still, the numbers are startling and would have dominated newscasts only 2 months ago. Discussion of this data is currently restricted to mathematicians and epidemiologists, as well as policymakers, on Twitter's COVID Twitter platform. So, what's the deal here? Since Boris Johnson's announcement of Freedom Day Mark II, we've only had 3 weeks to prepare for another wave of COVID-19. Research fellow and modeler Colin Angus of the University of Sheffield asserts that there is no one smoking gun. Instead, he told The Telegraph, the recent surge is likely due to a variety of factors, as is the case in numerous European nations. Vaccine waning, changed behavior, and even novel variations may all play a role in the spread of the disease. Since the COVID immunization deployment has essentially destroyed the relationship between infection and serious illness, we conceive of Omicron as a minor version. However, the latest outbreak in Hong Kong serves as a stark reminder of the dangers of not protecting the most vulnerable members of society. As of Sunday, 3,993 coronavirus deaths have been documented in Hong Kong, and the absence of immunity is resulting in terrible results and unprecedented strain on the city's healthcare system, which has witnessed 3,993 deaths in the last 12 days.